Hi, I'm Dr. Shel. Today I'd like to speak to you about a topic that a lot of people have some confusion about, and I'd like to spend a little time to go over it in depth. The topic is bioidentical hormone replacement therapy. Now, the reason this may be confusing to a lot of people is most of us have heard of hormones, right? We've heard of this for decades, and perhaps you're even on hormones. But the key is to know the distinction between the different kinds of hormones. So let's first talk about why somebody might need hormones to begin with. Well, as we age, we go through different processes. So let's talk about women first. Women go through teenage years. Most of the times, everything's okay there. There might be some fluctuations in hormones dealing with irregular periods, acne, etc. And that's a specialized case. Then you go into your reproductive years. So once you have children, your hormones definitely fluctuate during pregnancy as well as tremendously after pregnancy, as evident by postpartum blues, postpartum depression, and other things that women go through. We then go through a perimenopausal stage in your 40s, and usually 50 and beyond, you go through menopause. So as we age, we go through different elements that really have different effects on our bodies. And a lot of times in traditional medicine, we have been used to our gynecologist giving us birth control pills, even if you're a teenager, even if you've just had a baby, or if you're trying to conceive, perhaps other medications to try to help you conceive. And then in your perimenopause, perhaps other medications or hormones that somehow mask these symptoms. And then menopausal times, of course, hormone replacement therapy is probably what you've heard of the most. Now, let's talk about the causes and the symptoms that are associated with these causes. So some of the symptoms that women and men can both go through when they have hormonal imbalance are fatigue, hair loss, loss of sex drive, loss of libido, loss of muscle mass. You may also go through hair loss and depression and weight gain and anxiety and insomnia. All of those things can be related to hormonal fluctuations, both in women and in men. So it's important to realize that women are not the only ones that go through hormonal fluctuations. Men also go through a process called andropause. There's actually a term for it. Andropause, the simple meaning for that is male menopause. So as men age, and usually it's about 40s and beyond, but I have seen many men in their 30s who have very low testosterone levels. And sometimes you don't know why, and other times you do. But men who start declining on their levels of testosterone feel a lot of symptoms such as loss of muscle mass, weight gain, especially around the belly, irritability, brain fog, lack of mental function, loss of libido, loss of muscle mass, not responding. Their body just doesn't respond to the exercise they might be doing. And they wonder what may be going on. Can't be testosterone because I'm manly. I don't need, I don't have low testosterone. And it's really important for men to also realize it's just a natural progression of life. Just like in a woman, it's a natural progression of life when they end up in menopause. So all of those things can be going on. All of these symptoms can be going on. And some of the causes are, like I mentioned, simple aging, toxins, lack of balance in other areas such as stress might even lead to hormonal imbalance earlier, thyroid imbalancing, lack of exercise, poor diet. All of those are really important causes, and one must really look and see what might be triggering some of my hormonal imbalance. Now that we've talked about some of the symptoms and causes in both men and women, let's talk about treatment. What do we do about it? So first of all, I would advise you to find a functional or an integrative medicine doctor who can put this entire picture together for you so that they're not just looking at hormones, but they also can be looking at your nutrients, your diet, your exercise, your stress, your thyroid, and put it all together and do some really good testing. Now, I prefer saliva testing for women because it really gives you the tissue levels of the hormones and the cortisol. There are circumstances when we do blood testing, and that's okay too. For men, either or is fine, but we do need to really look and see what is going on. And so you need to look at two components: the subjective, which is when we talk to the patient and really go through their symptoms, their causes, their history, and the objective, which is all the lab results. Once a doctor like myself puts it all together, we're able then to provide the treatment. And the treatment is bioidentical hormone replacement. Whether you're talking about your thyroid, you're talking about your sex hormones, which are estrogen, progesterone, DHEA, and testosterone, or your cortisol, which is your stress hormones or your adrenal hormones. Now, in men and women both, it's important to realize we both need estrogen, we both need testosterone, we both need progesterone and DHEA, albeit in very different levels. Men require a lot more testosterone, very little estrogen. Women, on the other hand, require more estrogen and progesterone and some testosterone, but very different doses, and that has to be customized based on who you are, what your history is, what your test results are. And it's very important to realize you do not want to take synthetic hormones, because as you, I'm sure, have heard, the studies, WHI, done in 2002 on Premarin and Prempro, those are not the hormones you want to be on, because they were tested and seen to have risks such as heart disease, breast cancer, strokes, and other such things. Bioidentical hormones are hormones that are biologically identical to what our bodies produce and what receptors we carry, so these hormones can really directly bind with the receptor and give you the positive impact that you need in your body. So once you make that choice that you want bioidentical hormones, there are also different things as far as the modalities of how we prescribe the hormones. The first modality is cream, which is topical hormone replacement. And these are creams that you can either apply to different parts of your body, and of course we counsel you on that, and this can be for men or women, creams or gels. The second would be sublingual, something that goes under the tongue. Those are very common as well as very efficient to be able to get these hormones in you. The next, for men especially, is injections of testosterone. And this is something that we do on a weekly basis for our male patients. And we have a strict protocol. So it's essentially 10 weeks on, 2 weeks off, to give the body a break and to allow your body to produce its own testosterone as well. So we have protocols that we stick to that are tested as well as safe and effective. And the final modality that's been very effective as well as very popular recently are pellet therapy. So in men and women both, testosterone can be actually placed inside the body, underneath the skin, and it's not noticeable and it's not painful, and it just sits there, and it can last up to 3 to 6 months in men and women, where it actually releases according to your cardiac output. So this is a very interesting therapy, and the estrogen and testosterone can be done with women, testosterone in men. So this is a brief overview of bioidentical hormones for you to be able to think about, ponder, and probably come up with some questions. And if this is something that you're interested in finding out more about, please feel free to give us a call or go to my website, drshel.com, and we'll be happy to provide you with more education and if you'd like a complimentary consultation.